Hi, everyone, and welcome to this session of UCalgary's webinar series. Today's webinar is part of UCalgary's annual program to support our partners at Calgary Pride during Calgary Pride Week, running this year from August 28th to September 6th. I'm Deborah Yedlin, and I'll be your moderator today. If you've participated in one of our previous webinars, welcome back. And to all our new viewers, thanks for joining us. I hope everyone has had a good summer. It's hard to believe today is September 1st. It's amazing. Here in Canada, the LGBTQ2S+ community has made significant progress in advocating for their rights and access to equality. Nevertheless, culturally, Canada is still playing catch up. It took until 1996, 17 years, for sexual orientation to be added to the Canadian Human Rights Act, and another 4 years for the definition of common law to include same-sex couples, extending benefits, pension, and income tax rights to LGBTQ2S+ couples. Same-sex marriage was legalized in 2005, but it took until 2015 for Alberta to pass legislation adding human rights protection from discrimination based on gender identity and gender expression. Nevertheless, the systems that help many Canadians stay spiritually, mentally, and physically healthy have, in many cases, actively harmed LGBTQ2S+ people. As a result, a section of our country's population does not yet have truly equal access to vital support and care. At UCalgary, there are academics and alumni working to change this narrative of exclusion. Two of them join us today for our discussion about inclusion in faith, education, and healthcare. Dr. Tanya Callahan, Associate Professor in the Workland School of Education, and Dr. Kaylee Shukolek, Clinical Assistant Professor in the Cummings School of Medicine. We'll hear from each of them individually and then open the conversation to questions from our audience. If you have a question during the webinar, please use the Q&A feature at the bottom of your screen. We'll get to as many of your questions as we can. And this webinar will also be available on demand, and we'll email you a link once it's online. Before we begin, I'd like to acknowledge that we're recording this webinar on the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta, Region 3. I'd like to also note mental health supports that are available to our community on campus. Students can reach out to the Student Wellness Services, and faculty, staff, and postdoctoral scholars can access supports through Staff Wellness and Homewood Health. For anyone in crisis or in need of after-hours support, call Woods Homes Community Resource Team or the Distress Center. Now, I'm pleased to introduce our first speaker. Dr. Tanya Callahan is an associate professor in the Workland School of Education. Dr. Callahan specializes in critical social justice theories, anti-oppression education, and anti-homophobia education. The overarching goal of Tanya's award-winning research is to integrate theory and practice so that educational stakeholders become motivated to free members of sexual and gender minority groups from religiously inspired heterosexist oppression. Tanya, over to you.
Thank you, Deb. Thank you so much for that introduction. I appreciate that. And happy Pride to everyone. So we are here to celebrate Pride, of course. Calgary Pride, I have my Pride flag here. And Pride is normally a happy undertaking, a happy celebration, and it is, and I'm happy to take part in Pride celebrations. I am a member of the LGBTQ, lesbian, gay, bisexual, transgender, queer, intersex community. I do identify as a lesbian, and I use she, her, they, them pronouns. But you know, Pride this year is 2020 is the 50th anniversary of Pride celebrations. They didn't always begin as a celebration, though. They began as a march, you know, to protest discrimination and oppression of this one vulnerable group. Here in Calgary, we're celebrating our 30th anniversary of Pride marches and celebrations. I've been in Calgary for quite some time, and I have been taking part in Pride since its early days. And in those early days, there were teachers there that had to wear brown paper bags over their heads in the march, which was very small because of the beginnings, right? So we didn't have huge numbers at that time. But you can see that if a teacher has to wear a brown paper bag over their head, then that means they're not feeling safe, right? So they're worried that someone's going to point out that they were at that Pride March and tell their employer, and that they might lose their job. And that was a clear and present danger 30 years ago, and sadly it is still a problem today, especially in faith-based schools where people feel that a person's sexual orientation or gender identity is a choice, and therefore something about morality. So the person's making a bad choice, a bad moral decision to live this quote-unquote lifestyle. So many of us have disproven that. And so this is something that is one of the things that I rail against in my research. I look at religiously inspired homophobia and transphobia in Catholic schools. And I'm currently doing an international comparative study involving certain Commonwealth nations, Canada, Australia, New Zealand, and the United Kingdom, and Catholic schools in those nations. We're interviewing people that identify as lesbian, gay, bisexual, transgender, intersex, that are teachers or students, former students in Catholic schools in those nations. And since it's Pride today, I would like to try to focus on some of the more uplifting findings, because there is a lot of sadness, there's a lot of oppression that we're trying to combat here, but there's also some resistance, which is pretty remarkable. And one of the most important findings from my studies, the current work that I'm doing, is that the youth are leading the revolution against religiously inspired homophobia and transphobia, and that those of us in the field of education or working in anti-oppression or anti-homophobia, anti-transphobia education need to do what we can to uplift those student leaders. And just to give you some of the examples, something that you can see what students are doing and young people are doing in their schools is we have something called a Gay Straight Alliance, which is a North American concept. And it's a place for young people to meet in school and feel supported, especially for gender and sexually diverse students and their allies, right? So Catholic schools have long been opposed to the Gay Straight Alliance. They especially don't like the word gay. They see it as too affirming of what they see, as I said earlier, as a lifestyle choice. And I put that kind of ironically in quotations, a lifestyle choice, and many of us would not agree with that description. So they try to oppose the establishment of gay straight alliances in the Catholic schools. But young people, notably Lee Iskander in Ontario here in Canada, fought long and hard to have a bona fide gay straight alliance established in their Catholic school. So when I say bona fide, I mean an actual, real, true gay straight alliance, not the watered down version that some Catholic school leaders were reluctantly willing to allow. So for example, they go by some odd names like By Your Side Spaces, with SIDE being an acronym for safety, inclusion, diversity, and equity. And if you were a 16-year-old in a high school today and you saw a poster saying By Your Side meeting at lunch in the music room today, would you have a clue what that is? Like, not likely. You wouldn't know what that meeting's about. And you wouldn't know that it's for you. And that was by design on the part of the Catholic education leaders. They wanted to make sure that these things wouldn't actually happen for LGBTQ students in their schools. So youth fought against that, and they were able to, change legislation and the law right in that province in Ontario. And Alberta has very similar legislation that requires that if students want to start a gay straight alliance in any school in Alberta, including faith-based schools, Catholic schools, private schools, etc., they must be allowed to do so. And they must be able to use the word gay in their title if they wish, because Catholic education leaders have been opposed to that word because they see it as too affirming of a particular lifestyle. There are other things that young people do in schools, like for example, some students I interviewed were talking about how they, in an option class in high school, they were invited to do some research about a community organization. And so because they identified as queer, they thought, let's do the queer community and do that. But they're in a Catholic school. So they proposed that to the teacher, and the teacher's like, no, you can't do that. So then they had to talk about why they should be allowed to do research on the topic. Then they were given the green light to go ahead and do that. And then when they started to conduct the research from the school, they found that there was a net nanny on the internet, so that anytime they wanted to find information about LGBTQ community in their town, they wouldn't get the positive and affirming information they were looking for, but they would get the fire and brimstone type of the websites that are out there that say that you're going to go and burn in hell and things like that, which were very traumatizing messages for these young people that identified as queer. So they were traumatized by that. They also didn't get the information that they needed. So they didn't sit there and take that. They actually took that to the attention of their teacher, who then had to take it to the administration, to IT. And then so we had to block and unblock some sites so that the young people could actually get some positive and affirming information about their own community and do that research in their own school. So that is some profound, leadership on the part of youth. And that's just an example of how we can resist what is currently happening in some of these schools. Another project I'm currently working on is a community-based project here in Calgary with the Center for Newcomers. We just shortened it to the Rainbow Railroad as a way of referring to it, because what we're talking about there is LGBTI, so lesbian, gay, bisexual, transgender, intersex individuals that come to Canada for as refugees from different parts of the world. There are over 70 nations in the world that have criminalized what they call homosexuality or homosexual acts. And so these people are, their lives are definitely in danger. And so they choose to come to Canada. And so what happens though is that a lot of these settlement organizations haven't really creatively imagined the LGBTQI individual that's coming to Canada. They haven't spent the time to think about the creative pairings, romantic pairings that people have when they come to this country. So not enough has been set up for the LGBTQ newcomer or refugee. However, here in Calgary at the Center for Newcomers, for the last 3 years, they have been focusing specifically on this group. And they would like to do a partnership here with researchers in Calgary, University of Calgary, looking at the intersectionality of the individual that comes to Canada and what their particular needs are. So we're really hoping to get that off the ground, and we're looking for donors. So if there's anyone out there that's interested in supporting this research, well, we'd be happy to talk to you. So I believe that brings me to the close of my time here. So I'm happy to move on to the next speaker and also to answer any questions that you may have at the end. So happy Pride, everyone.
Thank you, Tanya. Our second speaker today is Dr. Kaylee Shukalek, Clinical Assistant Professor in the Cummings School of Medicine and a UCalgary alumnus. His clinical and research interests, you'll have to bear with me for 1 second, I apologize. His clinical research focuses on prevention and management of sexually transmitted infections and the care of LGBTQ2S plus populations. In an attempt to reduce barriers, he is also involved in entrepreneurial work to provide HIV prevention tools to the LGBTQ2S plus population across Canada. I apologize, Kaylee. I was madly taking notes. Over to you for your presentation.
Fantastic. Thank you, Deborah. And thank you, Tanya, for that lovely introduction of your work as someone who made their, as a gay identifying man who made their way through the Catholic school system. Your work speaks to me tremendously from my own experiences. So like Deborah said, my name's Kaylee Shukalek. I'm a self-identifying gay man with pronouns he, him, his. And I'm a professor in the Cummings School of Medicine. So my own experience and interest, particularly in the LGBTQ2S community, I mean, it comes from personal experience, and it also comes from professional experience. So before my career in medicine, I had worked in the STI field, and I had a particular interest in HIV, which unfortunately has a predominant exposure or prevalence in at least the GBSM, or gay, bisexual, and other men who have sex with men community. And as a gay man, I've experienced my own discrimination and stigma within the healthcare system at the hands of providers, and myself as a provider. I've seen and heard stories from my patients as I work in sexual health with LGBTQ, predominantly GBS, MSM, and trans populations, and their experiences in the healthcare system thus far. I think healthcare as a provider, it's interesting. You have a really raw perspective of persons. They share their deepest, darkest secrets and their most vulnerable times with you, whether it's unwell or it's trying to solve a problem. You have that perspective as a physician, with my own colleagues who are physicians, with allied health staff such as nurses and pharmacists, and with the patient themselves. And unfortunately, there exists stigma in all of those interactions and those environments. And really, it's in all capacities, urban, rural. For myself, I look at the disparities, and there certainly are some in health within the sexual health realm as we look at the predominance of STIs and HIV among the GBMSM population. And unfortunately, largely unknown is the sexual health implications for female members of the LGBTQ2S population, with our lesbian counterparts not having the same sort of exposure and research underway. And then in the non-sexual realm, certainly there's statistics largely from outside of Canada involving increased rates of cancer, of heart disease, increased rates of tobacco and other substance uses, increased rates of mental health, particularly among suicide in teenage members of the LGBTQS population. And the unfortunate part, and this comes from the report that was done by the Standing Committee on Health from Canada, from our federal government, is that when they looked at the LGBTQ population and health disparities, there's actually a paucity or a lack of data within the Canadian context. And so in that report, they made a significant call for research within this area. And certainly they made note of sexual health disparities that are seen within the community, but also in non-sexual health. And they need to collect that data through avenues such as Statistics Canada, but also through funding through researchers in our Canadian Institutes of Health Research, as well as through social sciences, with the acknowledgement that health is so much more than direct patient care. Health involves all the social determinants of health, such as housing, food access, gender, socioeconomic status and income levels, education, and these are all opportunities to improve health through indirect avenues. Now, my own personal interests and whatnot through experience have, as a junior faculty, started out my research with initial investigations looking actually at LGBTQ2S identifying practitioners and looking at their own experiences in the healthcare system and how they've experienced discrimination themselves, witnessed discrimination of patients from other providers. And looking at that, it's quite interesting to see that it's not limited to older generations. It's not limited to rural or urban. It's pervasive throughout the environment of healthcare within Canada and the United States. And looking at these things, it's also clear that people aren't able to be themselves. And if a provider themselves can't, then it's unfair that they themselves would be able to provide equitable care to our sexual and gender diverse populations. Now, with hope, I plan to expand with colleagues this research into more qualitative work so that we can start to look at differing interventions. Thus far, there are initiatives to work on changing the way medical education is structured as a way to start in that direct patient care realm and changing the actual health outcomes of the LGBTQ2S population. So looking at medical education, as an alumni of the University of Calgary Medical School, I can tell you that there was a single 3-hour slot within our entire medical curriculum devoted to the LGBTQ2S population, where they constitute 5 to 10% of the population, depending on sexual preferences, sexual behaviors, and self-identification. This is a huge miss within the population, and integration of health disparities, health outcomes, and the uniqueness of populations and approaching those unique needs would certainly serve our community well. And so those are certainly some of the avenues that there's been calls for throughout the years from the College of Family Physicians, from the Royal College, which organizes our subspecialists in a variety, but but unfortunately there's yet to be action in really making a significant change in that realm. And certainly that's one of my areas of interest. The other is really access to care, as I think any LGBTQ2S community member listening here will certainly have had experiences where they may not have known where to find a provider who they felt comfortable disclosing all of themselves to. And so access to those things is certainly an issue. With COVID, it's there's this nice aspect of disruptive innovation and utilizing crisis for change with telemedicine, as we're really forced to look at non-physical visits and visitation. And so patients are able to access providers at a much greater distance to them, people who they would feel comfortable disclosing, and gain suitable healthcare resources. My own entrepreneurial interest in expanding HIV prevention across Canada in terms of our GBSM population, and a hope to actually expand that out to all of the LGBTQ2S population, to be able to provide care for anyone and everyone, really in your pocket or on your cell phone, from wherever you may be, rural, urban, the bus, your couch. It really is about creating that access to care that people at present do lack, and I mean high quality and comfortable care. So I think there's multiple other initiatives and interventions that could be effective in improving the health of our population and our community. Unfortunately, we do need more data, and we need more evidence in this regard. And certainly I hope that the call with the Standing Committee on Health has some traction.
Okay, thank you for your presentation, for both of you. It was very enlightening, and I know that there are questions that I'm going to start with that have already been sent. And so first question is, could you please say something about the initiative proposed by the Alberta government that would out students who participate in gay and straight alliances in their schools?
Yeah, I guess that one's for me. It's about schools. So absolutely, this is very, very frightening undertaking by this current government. That little detail was in the legislation previously because research has shown that students or young people are not necessarily safe in their own homes, those that identify as lesbian, gay, bisexual, transgender, queer. Unlike other forms of oppression, let's say, for example, racism, you can learn from your parent or guardian that you're growing up with how to contend with racism, because your parents could say, well, this is how I deal with it. And this is what you're going to encounter in school. However, for young LGBTI people, they are not always being raised by someone who's gender or sexually diverse. They're often being raised by heteronormative, cisnormative individuals. And so they can't learn from their own home environment how to cope with religiously inspired or just general oppression against this particular group, gender and sexual minorities. So they don't get that automatic, natural support from home. So they're not often safe at home. They're not safe at school if they're going to a school that doesn't even have a gay straight alliance and they would like to start one and they'd like to join one. And so they don't want that information being shared with their home because they may not be safe there. We don't know what's happening in a student's home. We know from research that it can be a very violent place for young people. And that also those who want to join a gay straight alliance, it's a big step for them, and many young people will take a lot of risks to do that. So for example, they might dress differently when they leave their home and take a different clothes with them to school so they can look and be themselves at school, then change back into whatever they are expected to wear at home. So we know when young people are doing that, they're not feeling safe at home. So this new undertaking by this current government to remove that detail from the previous legislation is extremely frightening, and it's not helpful for the safety of LGBTI youth.
And the importance of community as you go through this, as you navigate a new part of your life and how you choose to live your life is very important to have a support system. in order to go forward in a safe way. So, I go back to when I was in high school and when I was in junior high school, I mean, those alliances weren't there at all. So it makes me think about how language has changed and how we look at the community today. And I'm wondering if both of you could sort of talk about how the language has changed over the years around who identifies, how they identify, and how important the changes in the language have been from an acceptance point of view, and how important it's been to the individuals themselves.
Well, Kaylee, maybe you can take that up with the Men Who Have Sex with Men acronym and stuff, and I can talk about some other ones if you wish.
Sure. I think the language has been constantly evolving, and I think it will continue to. I think as humans, and this is not my area of expertise, though certainly something I'm aware of, is we have this tendency to identify things and put them in boxes.
Right.
Labels are appreciated and common, and the LGBTQ2S acronym is exactly that. It's expanded over time from LGBT to LGBTQ to recognition of other identities that people possess, and also how that's fluid and how that changes in the GBSM, or gay, bisexual, and men who have sex with men. It's really, from a health perspective, that MSM label is really an attempt to actually narrow it down to behaviors as opposed to specific identities. Mm-hmm. And I think that's really important. I look and I somewhat intentionally call out things such as Canadian Blood Services, who maintains a ban on gay men from donating blood. And while yes, the statistics and the epidemiology would be true that men who have had sex with men, particularly multiple anonymous partners, are at increased risk of HIV, and there is a window period in terms of diagnostics for HIV. However, the heterosexual population is also having multiple unprotected or anonymous partners, and that's not disclosed, that's not questioned. There's multiple aspects to their policies that are discriminatory, and really bearing it down into behaviors and individual, that patient-centered or unique individual perspective is far more important. And I look to some of my patients who over the time that I've known them, have sort of come to realization of their identities, changed from he, her to they, them, from he, him to they, them, and a variety of things. I think it's really important that we just be open to how individual identity evolves and expands and changes. And just that recognition that a label might be there for a period of time, but it's not permanent or even necessary, to be honest.
Tanya?
Well said, Kaylee. Yeah, I don't want to dwell too much on the acronyms, but from my perspective, I do international comparative research, and so I tend to use the acronym LGBTI, lesbian, gay, bisexual, transgender, intersex, and that is because international human rights law recognizes the identity of the individual. In a court of law, you have to talk about how you have been experiencing oppression on the basis of your identity, how you identify as a gay male, or as a bisexual person, as a lesbian. And so the word queer is too nebulous for a court of law. They can't understand the identity there. So it's conversely to what you had just said regarding behaviors. I'm talking about identities. And so I tend to use that acronym. But of course, there are many different acronyms that are used, and oftentimes community associations tend to use the longer one to be more inclusive of so many different identities that people have. Another way of expressing this group is gender and sexual diverse individuals, or gender and sexuality diverse. So there's another way of speaking about it.
Is there a risk that if you go too wide and too general, it actually ends up meaning nothing to anybody and it's not supportive or helpful?
So far, not so much, but the other thing that I was referring to in my little talk earlier was about, that's exactly what Catholic education leaders are trying to do when they want to have these innocuous names for gay-straight alliances. They don't want it to be clear. They want intentionally unclarity, so that people are like, we're not really sure what this meeting is. And they also want to have an overarching umbrella organization that that can attend to all manner of diversity in the school, rather than pinpointing it to this particular group that absolutely does need support. So they're saying, oh no, let's help everybody. But then if you do generalize too much, then who's going to show
You don't
up?
help anyone.
Yes, that's a problem in schools. But in terms of naming organizations or being clear about the group, I don't think it has been a problem, for gay pride centers or pride centers, for example.
I'm curious. You talked about international your research across the Commonwealth nations. Are you finding there are some countries that are more progressive than others, and what are they doing that's working that other members of the Commonwealth should take note of and look to implementing within their own jurisdictions?
Well,
what can you share that's helpful?
Yeah, well, there are many Commonwealth nations, and the ones that I'm narrowing it down to are Canada, Australia, New Zealand, and United Kingdom. Of those four, Canada is definitely the leader. So I know that in your talk, you're talking about how we have a lot of catch up. There are certainly areas where Canada has areas to grow. I mean, my area of research is an example, for example, how, there seems to be this way that Catholic schools can sidestep Canadian legislation and the law related to human rights. So we have to make sure there's no loophole for particular groups, particular schools. But Canada, generally speaking, amongst those four Commonwealth nations, has been a leader because of our Canadian Charter of Rights and Freedoms and the Section 15, the Equality Rights provision, that protects against discrimination on the basis of sexual orientation and gender identity. So these are very, very important pieces of legislation. Human rights legislation is very strong in this country. But we all know that, you can have legislation, law, policy, all of that, but people are going to find all sorts of ways to sidestep it and find their loopholes so they don't have to actually respect it. So that's we have to always hold people's feet to the fire and make sure that these important pieces of legislation that we have spent years developing are actually respected in our publicly funded institutions.
Kaylee, this is a question that's it's for you really. It's what's being done or can be done to increase gender affirming care in Alberta, because there are very few doctors willing to provide gender affirming care in Alberta. And I have a follow-up to that, but I'll let you answer that first.
Yeah, and I think that's a really difficult question to answer, in that independent practitioners, so physicians, are going to practice within their areas of interest, and certainly gender affirming care as it relates to those who identify as trans is a complicated process from a medical perspective, and so requires additional training and study, and so we have a few, certainly, though they are largely centered in our urban environments, so Calgary and Edmonton and Alberta specifically. There's been a bit of back and forth politically about what is covered, what is not in terms of gender affirming care, and I don't think that has done our trans community any service, because it certainly creates issue as it's unclear from day to day or month to month or year to year what they will be paying for out of pocket. Having practiced in the United States, or at least done some of my subspecialty training there, I can tell you that that's, that payment piece is a huge barrier to necessary access to care for a person to live as their own self-identified individual. And so it's not an easy question to answer. And certainly I have noticed a few younger colleagues who have expressed interest in these areas. But again, it's so practitioner or physician dependent. It requires them to have that specific interest to train and then practice within that realm. And so I'm not sure what, aside from in medical education, making it actually part of the curriculum, making people aware of it, I don't know how else that would be specifically implemented or increased.
So I'm guessing that's about residencies and internships and placements that could follow through from the medical education perspective, or as part of the pedagogy. Because you did say there was 1 3-hour slot throughout your medical school. But what steps or actions can healthcare providers take to ensure that those in the LGBTQS plus community experience inclusion and feel safe when they are seeking out care? Like, what should the healthcare providers do in this context? Because, you know, when you look at the population distribution, there's going to be a cohort within their practice that will be identified in that group. So what do they need to do? Is there continuing education? Like, what's available?
Yeah, and so there's continuing education through a few centers in the United States, as well as courses through University of British Columbia and through McGill, as those are the two largest centers of practice within this realm in Canada. It's a growing area of research in terms of ensuring that we provide appropriate gender affirming care. You know, in terms of Alberta specific, certainly there's that training, and much of it is actually available online or through weekend courses or conferences that, you know, in pre-COVID you would have attended in person. But so those things are there for physicians to access and seek out themselves. In terms of patients and how they access providers who have awareness of an expertise or to provide gender affirming care, you know, this is something that I've actually been in contact with the College of Physicians and Surgeons about, and this is something that's not yet available is, you know, you can search based on practice interests, and unfortunately, you know, LGBTQ2S or gender affirming care are not actually within that searchable frame. Myself, on my own Find a Physician profile, it does actually state, you know, a self-identified interest in these areas, but you can't actually search for me that way, which is, in my mind, a bit frustrating, as this does actually constitute or this is important to a significant number of patients.
Sure.
The other piece, and so this is, you know, when it doesn't exist, we have groups like the Center for Sexuality here in Calgary, Edmonton's Mental Health Collective, Edmonton Pride, who are actually compiling their own lists for community members to be able to reference, so that they know where to get this from. They know where to find these people and how to access care through them, because our regulatory bodies aren't providing that ability.
Whereas you could easily find a sports medicine doc, that's pretty easy, right?
Yep.
So there's definitely a gap. I'm curious, I'd like to hear from both of you about parents who have children that have decided to identify in a way that they didn't expect, anticipate, and have decided to identify in the LGBTQ2S plus community. I know there's an organization called PFLAG, but I think, can you talk a bit about how the parents need support or guidance, or how they can make it easier for their children to navigate their new, you know, how they've chosen to identify?
Yes.
And what might have been helpful, you know, for both of you when you were younger.
Yeah.
Or to your parents.
I'm really happy for PFLAG, the existence of PFLAG, that stands for Parents and Friends of Lesbians and Gays. You can tell even by the title that it's super old, right? It's from the time of those words, lesbian and gay. So it's been around for a long, long time. It's a support group really for parents to figure out like how to approach this. Their child has come out as gay or lesbian. They don't know what to do. It's against their faith beliefs. How can we reconcile the two? How can we be queer and Christian without contradiction? Those are the kinds of things that they will explore in those meetings. But parents are, like, young people are coming out at younger and younger ages about their sexual orientation and gender identity, especially gender identity. I mean, toddlers are saying, like, no, I identify as I'm a girl now, they're saying to their parent. So this is very young. And so parents, I'm really pleased with a lot of parents. They're just rolling with it. You're just like, okay, this is how it is. And a lot of parents are like, we have these gender reveal parties you might have seen, where a lot of horrible things happen. Like they shoot things into the air, then a whole field goes afire because they want to celebrate the gender of their child, like a male boy being born or female being born. So other parents are being opposite of that, going completely against that, saying, listen, we don't know. We're going to wait until our child shows us what their gender is.
Mm-hmm.
So, you know, what their sex is assigned at birth is something different than their gender. So So parents or some parents are very open-minded and saying, we're not even going to tell you the sex of our child. So there's quite an extreme. You can imagine what political spectrum is which, or left or right. So parents need a lot of guidance and support. There are groups available for them, and certainly the internet is a great source of information for how to join support groups in their local area. And you know, parents, like I mentioned earlier, they are the key to providing a safe space for their child. If their child's not feeling safe in their own home, and then they go to school and don't feel safe there either, I mean, they're at risk for taking their own lives, for dying from suicide. That is a reality. And so the parents have a very important role to play to provide a safe space for their young person. And they need to inform themselves about gender and sexual expression, gender identity, sexual orientation. If they feel that their child is not identifying as heterosexual or cisnormative, cisgendered. So if they see that they have a unique and special child, then they learn about it.
Kaylee, your thoughts?
Yeah, and I mean, thank you, Tanya. I don't know how much more I have to add as opposed to, or I guess, in addition, maybe stating that, you know, your child is so unique and so independent, and for parents, it's about being that supportive system. Some of that's going to come through existing organizations such as PFLAG. That's going to come through resources, you know, your local pride centers or organizations that I know for a fact would be happy to have parents reach out to, or if you know they were struggling with how to best support their child in how they identify, whether that's sexually or gender diverse or both, and so just seeking out those resources. You know, I don't tell my patients to do this, but Google can be your best friend in terms of finding some resources related to this, and the world is in your hand, really. The other is simply the perspective that your child is your child, and you love them if they play soccer, and you love them if they play hockey. You know, it's general society that makes these preconceived notions about heterosexual behaviors, cisgendered identities, and I think that's a mistake for all of us to make. Not one or a person individually. It's you know, each person is unique and individual, and we should just allow them to be themselves. And parents really should just value their children for who they are and support them. The last thing I would say is if you have that relationship with your child, sometimes it's as simple as a question. You know, it's actually things my parents did with me was simply to ask me. You know, I didn't come out till a little bit later, but they just, you know, great, how can we help you, support you? What do you need from us?
What did you tell them when they asked you that question?
I had no idea what to say to them, to be perfectly honest. I think I eventually, in the later conversation, just said, I am who I am, and just, you know, I don't want to be any different in your eyes. And they simply replied with, you aren't. So it's a conversation like it would be, you know, your child versus your friend versus your coworker. And I think it's that openness that allows acceptance.
I guess when you look at, Tanya, perhaps when you look at what the conversations that people have today versus, you know, let's say 20 years ago, when you look back at your own journey, what do you wish you would have had access to, or what kind of conversations do you wish you would have been able to have or did have, but not, you know, things have changed so much today versus when you would have identified and been out, so to speak?
Oh, I think first and foremost is the Gay Straight Alliance. I mean, that is a lifesaver. There has been research done that has shown that the Gay Straight Alliance is not only saving the lives of LGBTQ, lesbian, gay, bisexual, transgender, queer, intersex students, but actually is reducing the level of violence and oppression of different kinds in the school generally. So just the mere presence of a Gay Straight Alliance will reduce harassment, violence of different kinds, sexism, racism in the school, because it sends a message that the school values difference and diversity And that from the leadership of that school down, they're saying, listen, we're not going to tolerate this homophobia, transphobia in our school. We have this Gay Straight Alliance over here. It's supposed to be there to make sure that people that identify as lesbian, gay, bisexual, transgender, or queer feel like they have a safe space to go, and they're there with their allies. So it's just the presence of the Gay Straight Alliance can reduce violence in a school. So if I had that, if I had known there was a Gay Straight Alliance, you know, I would have been a lot more comfortable in the schooling that I experienced.
So actually, there's a question that really dovetails into what you just said. So we have, you know, in schools, those alliances can be established, but to what extent is it the responsibility of the school or institution to provide those spaces where they haven't been already founded? Or is it on the students to establish such an organization? You know, we have the Q Center at the University of Calgary as another example. So where's the onus? Is it on the students, or is it on the institution to recognize we need this for our students, for their mental health, to make them feel accepted, help them feel accepted? It's on us.
Yeah, well, the Gay Straight Alliance is a student-centered concept. So the students have to want the Gay Straight Alliance. So it doesn't work if the adults in the building say, hey kids, we're gonna make a Gay Straight Alliance for you. Come on and join it. The students are the activists in wanting this, and so they have to know that they exist for one thing. So what the adults in the building can do is talk about them in their classes. The administrators of the school can say that these are things, these are options that you can create, but the students have to come forward and say that they want it. So that is you know, it's a difficulty in itself, because it expects that the young person, whether they're a straight ally or a person that identifies as LGBTI, has the wherewithal or the gumption or the chutzpah, if you will, to go and speak to the administrators of that school and say, do you know what, this is what we need here and this is what we want. That's requires a lot of activism on the part of the student. Luckily, we have a lot of young people who are very activist oriented and very much wanting to see change in their schools. And we just talk to any young person today and you'll see that they're very much aware of justice issues. One of the first things they will say is, that's not fair. You know, they want things to be fair in their schools. So young people, it's not unusual to see a young person wanting a Gay Straight Alliance, but what does happen is they may not even know that it exists, right? So we have information overload, we have the information highway, the internet, and there's only so many things a young person can be aware of. So they might not know about it. So it's on the part of the adults in the building, so the leaders of the school administrators, teachers, whoever, to talk about these things openly in whatever school they may be in, so that students can start to think, aha, you know what, we would like that in our school. Or they might have a Gay Straight Alliance in that school that existed 4 years ago, but it just went, there was different administration in the school, they didn't support it, didn't talk about it, and then it just went by the wayside. So we have to let them be resurrected again. And so the teachers and administrators of that school have to create a safe space where students can feel comfortable enough to even broach these topics in the school.
What about just messaging that that's something that there's room for, instead of establishing it on behalf of the students?
Yeah, just saying that, absolutely, just talking about the need for these things, how they work, what is it, and just saying that, like, having as a list of all the clubs that are available in the school, one of them is the Gay Straight Alliance is an availability. Yeah.
Really?
Yeah,
you took yourself off mute.
Yeah, no, I was just going to add to that I think I would agree wholeheartedly with Tanya that I think it needs to be student-led, and I think there's a power to the student-led initiatives. If I, can speak to actually within the medical school at the University of Calgary, to borrow actually from, there's a new group that has been created and has really pushed for change within the medical education curriculum is Black Students Medical Association.
Right.
And they're pushing for change in regards to the discussion of race and how that affects, or how that's implicated in medical education and care and disparity of health outcomes, and how it's taught to medical students and outside of medical students too, right? Other healthcare practitioners, and I see that being applicable outside of health in all education, and applicable outside of race as well. And it's actually created a bit of change that I'm hoping to take opportunity of as an educator within the Cummings School of Medicine for equity, diversity, inclusion based models, in which case we can include, topics related to sexual and gender diversity in addition to race and every other, grouping or that may be disparate in for whatever reason. So I think there's the piece that is student led and it has power to it, but at some point in the case of medical education, I think there's an institutional requirement, because if the institution is continuing to push what I would consider non-EDI or non-equitable, diverse and inclusive curriculum, structure, rules, then the institution needs to change, and they need to be able to embrace that change and carry it forward, whether or not that student-led initiative maintains the same power and ambition that it initially had.
So it sort of dovetails into a question I wanted to ask Tanya. It's about, it goes to your introduction of the Rainbow Railroad. And maybe you could tell us a bit more in terms of what you're trying to achieve with that, but also tell us about the needs of our refugees and immigrants that aren't being met, how their needs are different than people who are Canadian and have, grown up in this country versus coming to Canada under challenging circumstances for so many. Just tell us more about the Rainbow Railroad and what you're hoping you can achieve with this research.
Well, thank you for that. Yes, this is just an idea that we're trying to get off the ground here. So we are looking for donors, anyone that would be interested in this particular topic. A Rainbow Railroad is a conduit. It's a way of saving LGBTI individuals from around the world to a safer country where there's legislation in the law that protects them from discrimination on the basis of sexual orientation and gender identity. So there's over 70 countries in the world where, you can experience persecution and, as far as the death penalty because of your identity in that regard. So Canada has been quite a good leader in this regard. Certainly Rainbow Railroad started in Toronto. We have a version of it here in Calgary at the Center for New.
Sorry, how long has the version in Calgary been in how long ago was it established?
About 3 years ago.
Okay.
So the Center for Newcomers here in Calgary has attended to LGBTQI newcomers or refugees for the last 3 years, and they've had about 500 plus people coming through that identify as lesbian, gay, bisexual, transgender, intersex. And they've found ways to make sure that their needs are met. So they're doing a great job, like A++ on that one with Center for Newcomers. And so they would like to partner with us here at the University of Calgary with the Workman School of Education researchers to look at some theories of intersectionality so that we can maybe come up with a train-the-trainer model to show best practices for those that who run refugee settlement centers, but don't really think about the LGBTI refugee. So the kinds of things that they need to think about to make sure that those people are safe once they get here, because we know Sarah Hegazi, a person from Cairo, Egypt, was brought to Canada around 2018 after suffering some major discrimination and unfortunately torture in Cairo. So she came to Canada, to Toronto, but there wasn't enough supports in place for her there, so that in fact she ended up dying by suicide, which is a very tragic story. We want to avoid those kinds of things happening. And so the work of the Center for Newcomers and the work that they've been doing for the last 3 years to attend specifically to LGBTI newcomer and refugee is just key work. It has the potential to save lives. And so we feel honored that the Center for Newcomers is willing to work with researchers at UCalgary to talk about the intersectionality piece. And so we'd like to see some people out there that are interested in this type of work, that would looking for a place to invest their money or donate. We're looking for partners in that regard.
So running up towards the end of our hour, I guess, I think there are a lot of people that may be tuning in that read the papers and they wonder why we've seen some violence against the gay community starting to arise again. Certainly a horrific story in Vancouver in the last 2 weeks. why are we starting to see this? And I guess it's an indication that perhaps we haven't come as far as a society as we'd like to think we have. So question, part one is, why are we seeing this kind of violence? And part B is, where else, how, we've come far, but we have a whole lot further to go. Robert Frost, I guess you could use that analogy. What else do we need to do as a society? And I welcome your both your comments, obviously, on these two topics. And then we'll close it off.
Oh, okay, I'll start first then. Well, you know, I work in areas of human rights, legislation, and the law, and these things are never absolute. We have to continually fight for them. They're always at risk. And it has to do with the changing of governments and political will. So right now you're seeing a rise in definitely in transphobic and homophobic violence all over the world, unfortunately, including Canada, including here in the city. And, you know, that it can be directly correlated to the rise in populism and fascism around the world. These are unfortunate ideologies that do not appreciate difference and diversity. And we have learned that difference and diversity is the spice of life. I mean, farmers, we are in southern Alberta here, we have a lot of farmland. Farmers know that if you plant a monocrop, you're not going to get a strong crop and it's not good for the soil. We all know that diversity is essential for life, for living. And so there is an increase in these kinds of homophobic and transphobic crime. What we need to do is stay ever vigilant for the human rights advances that we have made and remember what they are and put them into practice. When we have these legislation and the law and policy and all this, we have to follow those things that we have created and make sure that they are you know, put into practice and followed, because we can always lose these rights that we have gained. It depends if you believe in progress as something that we're always going to be progressing. Well, we can regress as a society as well, and we have to be ever vigilant that we're continuing to respect the legislation and the law that we have worked so hard to develop.
Kaylee, final word to you.
Yeah, and I think just to add on to Tanya's comments is I think we're seeing, and this is not isolation in terms of the LGBTQ2S community, but there's polarization, there's divisive natures within society here in Canada, south of us, and throughout the world. And I question how much that, you know, relates to this lack of openness to diversity. And I agree that political will, as we have shifts in government, it dies and it needs to kind of regain steam. And you know, the comments of Vancouver in the last few weeks, but in the last few weeks, there's been several reported, and these are in the criminal justice system, but presently, but within Calgary itself, a single weekend when there were 3 events of physical violence against LGBTQ2S members of the community, some requiring hospitalization and intervention. You know, these are things that, you know, we look at the struggle that women have had in terms of equal rights, and they're still fighting that battle. And you know, the LGBTQ community we had a much later start in this battle, and unfortunately, I think it is going to persist for some time. But it is that constant attention and will for change and openness to diversity that's important. I love the example of the crops and farmers, because it's something that most Albertans, particularly rural Albertans, can understand and perhaps identify with as an important aspect to human life and nature in general. But really, we just need to keep the fire burning in terms of change for openness and inclusion for all persons, regardless of gender, race, or sexuality. And
it's on us to make sure that we are not bystanders,
exactly.
that we get involved. And I think that's such an important thing for everybody to remember. We're part of this community and we have to support everybody. I really want to thank both of you for your comments, for your answers, and it's been a very interesting hour for all of us that have tuned in. So as I mentioned earlier, everyone who signed up today will get an email with a link to view the session on demand. And please join us for our next webinar on September 8th about managing stress and anxiety that can arise from transitions, such as returning to school or work, sending children back to school after so many months away, and in fact, transitioning in terms of your gender identity. That's obviously another area of stress and challenge. So this fits into what we've just been discussing today. More information about this webinar and Pride Week events are available at ucalgary.ca/community. Thanks everyone for joining us. See you next time.
Bye-bye.
Bye.
Thank you.
Happy Pride.
Happy
Happy
Pride.
Pride.